Well, I think everyone throughout the world will agree that even though it's a pandemic, a worldwide outbreak, has been predicted by the Centers for Disease Control and other public health authorities for many years. When I was at CDC, I remember I was part of a group that was trained to respond wherever in the world there was an outbreak of bird flu or SARS, and this was after the SARS outbreak. And at that time, the top scientists in the world, epidemiologists and physician who study and work with infectious disease, were saying it's not if, it's when we're going to have a pandemic where people are dying and it's really serious. So I think we've realized what they were saying. We have had that, we're having that right now. And what it means to the cruise ship industry, of course, it's been a devastating thing economically and for the entire industry. It is a virus, and in many ways, it's similar to norovirus in its spread, person to person, person to object to another person. The difference is that it can be spread through the air and through the respiratory tract. And norovirus, of course, has to be swallowed. But the way that it's spread, as far as person to person or person to object, like elevator buttons or something like that, someone touches that and touches their mouth and swallows the virus, or in the case of COVID, maybe they touch it and then rub their nose and the same thing happens. So in some ways, it can be dealt with in similar methods as norovirus. In other ways, of course, the aerosol spread is the most dangerous. And of course, people are wearing masks. People are being vaccinated. We don't have a vaccine for norovirus, but people are doing everything that the science, of the available science, can provide as far as recommendations. And I think we just have to follow the scientific pathway. When something new, one of the problems that a lot of people have is if you're not a scientist, if you haven't been through the process and really studied it, then sometimes you can get confused when you hear more than one opinion of something. And of course, we're replete with more than one opinions on SARS, and from scientists, not just from the public, but from scientists. But what people don't understand is this is science. Everybody doesn't agree on. In fact, scientists don't agree on hardly anything. 100%.
Right, it's uncertainty. 100%. It's built into it.
But they often do, and they come to agreement on certain things, certain aspects of something. And so I think that as consumers and as people that are listening and trying to do the best for, in the case of the cruise industry, for their passengers, in the case of the public, for their children and their family and their friends, then I think we have to follow the recommendations that most scientists are putting forward. because if the majority of them are agreeing on certain aspects, like wearing a mask, okay, that's a very controversial, but we do know, I mean, I wouldn't want to have surgery done by a group of physicians, nurses, and other attendants that were not wearing masks. And most of us wouldn't. So we know that masks have some preventive measure. And so I was just recently on a cruise ship working, and we all, even though we were vaccinated and were having PCR tests, we wore masks. And so, yes, I think the industry is doing its very best, and I think they will continue to do their very best to protect their passengers and their crew. And how will they do that? They will follow the scientific, what the scientists agree on, and sort of the scientific theory. And people say it's only a theory. Well, sometimes that's the best we have until we've had enough time to actually try out that theory and make sure, adjust it or whatever until it becomes fact.